All right, I'm hoping that it's going to get better now. My apologies once again, hoping that the sound is better now and that there's not an echo happening anymore with this live stream. I want to thank you for your patience. We are streaming here on Facebook as well as streaming on YouTube. I am in conversation today with Girmay Haile, who is a well-respected former UN official. I met him when he was the UNAIDS country director in Ghana, and I was the host and reporter on the Maternal Health Channel TV series. And the last few years, he's been based in Zimbabwe. He continues to speak out on issues in Africa, and most recently, he's been involved in a lot of conversations about the COVID-19 response in Eritrea. 2 weeks ago, Eritrea reported that its 39 COVID-19 patients had successfully recovered from the virus. And this was a statement that was issued by the country's Ministry of Health. As of today, they still have no recorded deaths of coronavirus. And as far as I know, there's no new infections that have been reported either. So let's get ready to have this conversation. I will add Girmay to the chat so that we can discuss further about the country's response to COVID-19. Now, let me see. I'm trying to unmute your mic now because I was having those technical issues before, so I muted the mic. Let me unmute you. Okay, you can unmute yourself. It says you've muted yourself. So if you can unmute your mic, and then perfect. Welcome and thank you so much, Sir Haile, for giving us your time to have this important discussion about what's happening in Eritrea and other parts of Africa with respect to the COVID-19 pandemic. As of today, recorded cases around the world are over 5.2 million of COVID-19, over 364,000 deaths, and over 2.4 million recoveries around the world. And when we look at Africa, Africa as of today's date is doing quite well compared to the rest of the world. There's 135,000, over 135,000 cases, about 3,923 deaths, and there's over 56,000 recoveries on the continent. Now, so let's talk about, you're in Southern Africa right now. However, you do have a lot of expertise about the Horn of Africa. So let's talk about Eritrea, because I tweeted, you had posted in social media about the recoveries, and then I tweeted about it, and I got a lot of people who were pushing back on it, saying that they didn't believe it. First of all, take us through the steps of what exactly Eritrea did from the beginning and then getting towards having the full recovery.
Yes, I saw those tweets and responses as well. It was a very interesting debate that went on your post. You see, this is a pandemic, and many people forget to remember that the pandemic is not something that happens every day. So therefore, you are all and prepared for it and know what you're supposed to do and how you're supposed to do it. For most countries, it has been a challenge as to what approach and how quick to take, because they are also dependent a lot on the information and guidance they get from global sources as they are structured. And some countries like Eritrea are more of inward looking in terms of the very strong policies and also very strong leadership and the way the communities are also structured. And so therefore, when the pandemic hit and the news of it came out towards the end of December, early January, the first reaction the government had was, okay, what does it take now to respond to this pandemic? What are the kind of items that we need, both medical and non-medical? And also, what is the mobilization that we need to put in place? So these questions were answered in early January, and quite a lot of pre-positioning of PPE items and other medical items were done through procurement right away. And so by the time the first case was reported in Eritrea in mid-March, towards third week of March. The country had already done the training for its medical staff. It had already identified potential hotspots and also put in place a social protection policy that will now allow it to implement a very strict lockdown regime that will also not affect the livelihood of people. So these are the kind of roles they played. And immediately after that, also, they did come up with a preparedness plan that span up to from February to August, and costed that plan and also mobilized whatever they needed to get that plan rolling. So it was the early response that the government decided to do. And when the pandemic then manifested itself in Eritrea, then they were very quick to close down the borders. And they were also very straightforward in terms of quarantining everybody that traveled into Eritrea, because the primary source of the infection up to that point, and mostly it stayed on like that until the end, are people who had traveled with travel history. And then the contact tracing system was also quickly put in place. So therefore, all people that came into contact with any one of those people identified to have had the virus were also quarantined effectively. So quarantine was at the government's cost. There was no out-of-pocket cost. And those that tested positive from day one were also taken to the hospital for case management and care. And so therefore, every COVID positive patient had a similar standard quality and follow-up in terms of their case management once they were identified. So this way, they were able to curb the potential spread of the pandemic, and that pause in the spread was what probably now gave them the opportunity to focus on treatment and recovery of the patients. Now, in this, of course, there is a very strong commitment to leadership. I'm sure you've heard the president speaking several times on these issues with very firm position that we're going to have to fight through this. There was also a government call to fund the response plan, and that link between the people and the government in terms of having a common cause or a common reason to come together to fight this thing together was also quite evident in the Eritrean case, and a lot of money within, I don't know, something like $15 million was raised within a span of 3 weeks, and still continuing to also come in. So this role of the people participating in the national response boosted not now the health response, but the non-health response, which is now the social protection response, where people get food, household level food security is guaranteed, and that Eritrea also, if you look at its history a bit further back, it is one of the very few countries that had attained several MDG goals and all of the health goals as well. And health service in Eritrea and education service in Eritrea up to tertiary level is free, so people have access. And the other very important social protection measure that the government took was that salaries were not going to be disrupted during these periods of lockdown. And those families that are considered to be within the extreme poverty were also provided with essential food and medical and hygiene supplies. And the other quick measure they took was also to ensure that they do not continue to become dependent for the PPEs on external donation or external purchase. So a lot of the production plants and manufacturing plants in the country were turned into producing PPE material, masks and sanitizers and what have you. So they quickly achieved self-sufficiency in that sense. And finally, what came out of it is we saw that all the 39 positives uh, recovered fully. And immediately after that, the government has embarked on a mass testing and sample testing also in some places. All the All the major urban centers are undergoing currently this mass testing. And of course, the frontline people who are highly exposed to COVID virus are the health personnel, and they're also part of this testing scheme that the government has underway. Until now, I don't know the numbers yet, but quite a big number of testing has taken place, and no new infection of COVID-19 has been found to date.
Okay. Okay. One of the things that you mentioned, $15 million being raised. Is that money that was raised part of what they're using to support the people that you were saying that those in poverty and making sure that people's salaries are not disrupted? Is the funding coming from there, or does the government have money somewhere that they're using to support these people?
Well, the funding that we talked about, the 15 million, came from Eritreans in the diaspora and from within the country.
Okay,
So
all right.
that is people contribution. But also the government, like I said earlier, since the biggest budget goes to health and education, there's already a component of social protection integrated with the health program. And so therefore that identification of the society, which is a very well structured society, and knowing who is poor, who can afford, who cannot afford, who is employed, who is not employed, and this additional money now was contributing towards strengthening those that have to continuously pay the salaries to the workers and whose businesses have been disrupted, and also those members of community that are being supported directly by the government. And this money was contributing to that. Like I said, there was a preparedness plan that the government prepared that ran from February to August 2020, and it was costed at around $12 million. And so this is where this money has gone into.
Okay. Now, with the period of quarantine that happened, is the country still under quarantine right now? Because I know initially they had said a 21-day quarantine was implemented. Has that been extended?
Well, the 21-day was implemented and that was extended, and it had become indefinite. And now, slowly, some businesses are beginning to open up after the last case was released from hospital. But now they are also, like I said, doing mass testing, which is going to be now a basis for the new research and understanding of the epidemic in the country, and to be able to see how now to open up. But one thing is for certain: the borders and flights will not be open anytime soon. But the internal economic activities may be relaxed once they have a confirmed and positive response from the testing that they're doing now.
How long do you anticipate that borders will continue to be closed? Because that's a question that a lot of people keep asking about different countries. Even here in Ghana, I have a lot of people asking, when are the borders opening?
Well, you see, border opening has really very little to do with the national government, and it has more to do with the international situation.
Of course.
And as you know, and probably I should have mentioned earlier, you know, the global leadership in this pandemic was one of very confused and totally incoherent and unfortunately inadequate. I say that yes, WHO had their health response and advice, but that is only a health sector advice. But the pandemic does not only affect the health sector; it affects as much the non-health sector. So there was no comprehensive global leadership in this. And then on top of that, there was also lack of understanding of unmet needs for pandemic response, globally speaking, and also uneven and incomprehensible technology disparity among the countries. Some countries that had the strongest knowledge, the strongest research institutes, the strongest information institutes, and high intelligence levels were the first ones to fail in terms of this response, therefore completely derailing the rest of the countries in the world. And if you have noticed, also the G7 met, and the G7 talked about the G7 and the fact that the United Nations Security Council has not yet taken any resolution in terms of what the global direction is going to be, in itself shows that quite a number of countries have now completely lost out on the table, and so therefore voices are not heard. So as long as there is no guarantee that we don't have a situation in which we are fueling the epidemic, the pandemic rather, to come back again, I don't think any country will be ready to open the borders as yet.
Yeah.
However, this again is from the health point of view, but from the economic point of view, there are also quite a number of other issues that need to come into play. We also have quite a number of regional organizations that also need to pick up their roles in terms of what kind of coordination needs to be happening. And also, if this continues in Africa the way we see it, with low prevalence overall, then that means Africa can also start to open up within itself and start trading within itself and start opening up its borders within itself alone.
You make a very good point there about trading within themselves, because I have heard a lot of conversation within business communities, between leaders in African countries, talking about how this will be Africa's time to now start to really mobilize with each other, because we're realizing how much we've been dependent as a continent on trade with countries outside of Africa, and that now there needs to be more efforts in coordinating and collaborating with each other and trading with each other. Especially now we're seeing that the case count is much lower in the continent overall, and if borders start opening between African countries, it might be less of a risk than opening up to some of the countries we see that have, tens of thousands of cases. What do you think is going to be the biggest benefit for countries like Eritrea and other countries in Africa out of this whole negative situation of COVID-19?
Well, looking at Eritrea and also the southern Africa part, one positive outcome that needs to come out of this experience is the level of self-sufficiency that countries need to attain. And this comes with a very close look at their economies and also doing away with the redundant and unproductive sectors of their economies, and also misuse of money and corruption. And so they need to now start to channel and invest in their own capacities to do a lot. For example, one good example we talked about in relation to this was that Senegal was able to produce test kits for COVID-19. But where is it? It's not on the African market. And then there was Madagascar that through its research institute said that they have found medicine for treatment. And even that is being doubted and questioned even by our own Africans. So instead of really continuously to live in that dependency mentality that we have on the continent, in which our economies and our destinies and our existence is so dependent on other donations and on other tables, we need to start to come around and start to see how we start to become self-sufficient. So this is the first thing that I expect. The second thing is also the revamping of our regional institutions, including the African Union and its subsidiaries, as well as the regional organizations like ECOWAS and ECA and SADC. These now need to start to become the arms and legs of the organization, the AU. They need to start to become the arms and legs of enabling trade and enabling supportive environment for our markets and for our educated people. And we need to start to mobilize our capacities through these organizations. So I think it is a final call for these organizations. They really need to revamp themselves. Now, one thing that we have not taken advantage of in this COVID, for example, is we know that this is a collective threat for all of us. We have seen it globally happening in the same way. When we look at these other pandemics, like in Italy and Spain and in UK and in the US, we see a lot of other health and professionals and other expertise coming to help them. At the same time, they're also going there to learn from these other epidemics so that they're also preparing themselves. Except Somalia, none of our African countries decided to do that. And we had ample opportunity to learn from these other pandemics so that we are better strengthened when it comes, or if things turn worse for us. The other thing is the African Union did not immediately come up with a solution in which they start to create a critical mass of expertise that move around the countries to help countries set up their national response plans, to help countries get sources of resources, to share experience and also expertise. This has not happened. And these are the kind of things that we need to start to think about on this continent. Already this continent is a 1+ billion population continent. It has been divided by international institutions into sub-Saharan Africa and North Africa. It's very strange. Northern African countries have a very small number of Arabs, but they are put together with the Arab so with the Middle East and considered because they speak Arabic. And I don't think that is a correct analysis. So Africa has to reclaim itself in this situation. We have to also start to reclaim our ability to utilize each other's products and each other's markets and each other's expertise. This has to happen.
I agree. I definitely agree that we need to mobilize and work together. And yeah, and it's unfortunate that they divide the North and the South and the West and the East. And we need to find a way to come together. I think that I really do believe that this situation we're in has really opened up our eyes more to do that. And you brought up some really, really interesting points when you mentioned about seeing other countries and people helping each other, that we're not really doing that so much on the continent. Because what you mentioned earlier about Senegal having the dollar test kits, why aren't they being sold all over the world, even like across Africa and in other parts of the world? Wouldn't it make sense? If that test kit was developed in the United States, I could see people quickly rushing to buy it and selling it around the world. But for some reason, when an African country does it, it's not highly regarded and it's not being widely used or promoted. And as you mentioned with Madagascar, with what they created, I believe that we don't know. I can't say that I know it actually cures, but there's a strong possibility it could be something that is very helpful and could be very useful. And I think that it should be tested for international standards to see if it's something that, yeah, that definitely could be supportive of people who are being treated. If that was developed somewhere else, in Europe or, North America, I'm sure they would have been quick to start testing it. But unfortunately, that's not the case.
And there's also this inability that we have subtly accepted, the fact that we don't question ourselves and the fact that we don't learn from each other. For example, we had a massive Ebola outbreak in West Africa that killed over 11,000 people, and a lot of international response. Many African countries also played that role, sent doctors, volunteers, and everything to that response. But how come we didn't learn from that as a continent? How come that was not the basis for the African Union to mobilize now these kinds of forces, these kinds of centers of excellence for the countries and go forth? For example, if you look at the Africa pandemic picture, you see Egypt and South Africa leading by far, and then you have other very big spots: Ghana, Nigeria, Algeria, and Morocco. And then you see majority of West African countries and Central African countries put together have a lot more than 50%, 60% of the caseload that we have on the continent. Now, this is enough for us to say, now, this is where the burden is. These are the idle capacities that we have in the various countries. These are the unique things countries such as Eritrea, Mauritius, and these other countries are doing that we can learn from, and see now how we can cross-fertilize this capacity that we have. That will tell us whether we need any assistance from Jagma Foundation or not, you see. But we don't do that. And we need to really start to call on the African Union and these regional institutions that we have that are supposed to be providing this. WHO is a global organization. Why doesn't Africa have its own WHO? Closer to home. getting experiences, lessons learned, sharing, training people, preparing countries, helping countries identify their capacities in terms of manufacturing, especially pharmaceutical manufacturing. The African Union had a PMPA, a pharmaceutical manufacturing plan for Africa, where we were supposed to be addressing issues of medicine that needed to be produced here. Because, for example, one good story is on HIV and AIDS. When it costed us close to $10,000 per person per annum to treat one person. Once we got the intellectual property rights to develop generic drugs for HIV, which mainly at that time India and China had the capacity to do, and that reduction brought to about $76 per person per annum cost. That helped us expand the HIV services and reach out to as many as close to 90% of people who need treatment to have this treatment. But what happened? China and India used this platform. They provided over 96% of our HIV medication and commodity needs. And over time, they also developed the manufacturing quality. So now they started to go towards these bigger and designer medications. So therefore, not producing as much generic drug that we needed on the continent as they used to. This created a commodity insecurity for Africa. And the PMPA plan by the African Union was supposed to now address this gap, where African countries now need to be encouraged to have their own medication produced on the continent. But this has gone between cracks. Why? WHO has to give what we call the WHO pre-qualification. This is a standard that they give for manufacturers to be able um, uh, to get bids on their products to be distributed when any UN or global fund or those kinds of institutions buy these medicines. Simply because Africa did not have its own pre-qualification regime, we are dependent on WHO, and WHO will never give. And if they give it, it's going to cost these manufacturers a lot of money. So quite a number of manufacturers in Ghana and Nigeria and South Africa and Kenya went out of business because they were not getting, they spent a lot of money to invest to improve the manufacturing plants, but they're not getting the businesses. They're not getting these mega billion-dollar businesses that India and China have been taking from Africa. So this is where our failure is, and this is where now we have to start to bring governments and especially our collective regional institutions to account. They need to be able to provide these platforms. Eritrea alone can fight its little COVID struggle in the country, can win its COVID struggle in the country, but it cannot open its borders unless there are these guarantees that the entire world has moved in that partnership and in that leadership towards a better environment. So it is a catch-22 situation for many countries.
It's very, very unfortunate that that puts so much pressure on countries in Africa that can't even participate in the manufacturing because all those losses. That's really, I didn't know about all that you just explained. Thank you for sharing that information. So what do you think is going to happen with Africa right now? Because if WHO is the one who's giving the pre-qualifications, then that means that the trend may continue to go the same way as it has in the past with respect to, which manufacturing companies they give the green light to for manufacturing of medicines for COVID-19 or any other pandemic that may come in the future.
You see, when the United Nations was established, it was created in the images of its member states. And especially those member states that at that time of establishing the United Nations were the winners and the strongest nations, and they got the veto power, and this is what it is. If you look at WHO today, you have one individual who finances it over 60 or 70%, one individual philanthropist. This is how it is. It's captive. There is no global health business that is not captured. So therefore, that ability to muscle around is not there unless we start to create our own institutions that cater for us and also utilize our own expertise. And if we have to use additional expertise, at least we'll be stronger on the table. This has to be the way forward.
Okay.
If we are continuously allowing the diktat, for example, I mean, look at WHO. WHO is a global health organization. Mandate is very clear. It plays its role. But if you look at what does WHO exactly do in countries, you see that the majority of WHO direct involvement in countries is on emergency health, not on regular health.
Okay.
But you see World Bank and IMF coming into the countries to provide loans for these countries to build mega hospitals, big referral hospitals, huge ones that end up sucking 50, 60% of the nation's health budget. And that way undermining what Africa needs, a primary health program. If there are any African countries that have successfully managed this epidemic on the continent today, are countries that had invested sufficiently on the primary healthcare, their community healthcare. Eritrea, for sure, is definitely one big example of that one. There is no question about that. But many other countries also. And also, this gender issue, you know, I really always wonder how and when we are really going to look at in this continent the wealth that we have by balancing out genders. I mean, if you take for Ethiopia, for example, right now, the national COVID committee is led by all women. Minister of Health is woman, Minister of Peace is a woman, Minister of Transport is a woman, Minister of the Attorney General is a woman, and you know that in itself is something. Eritrea, the minister is a woman, and look at the results we are getting. Go around these many other countries. This is also one big potential that we have not tapped on this continent. I mean, if you compare Africa as a whole to the US, we have done well. We have had 5 female presidents in the past. America doesn't have or never had a female president. But we don't want to go into those kinds of comparisons. We
Yeah.
want to be able to utilize the potentials that this continent, half of it sleeping and not being given any access, to turn that around to make sure that our access today will improve our tomorrow if we start to pay attention to these kinds of things. So the Eritrean history is full of women's role from the liberation movement days up to now. There are quite a number of highly achieved women, very strong women that have very strong platforms as well, and they are heard. And this has to be replicated everywhere. And I think this is also one big potential and resource that we haven't tapped on this continent.
The gender issue is quite a big one that you mentioned, because I have heard that other countries, not just in Africa, but there's other countries around the world that they've noted that are led by women that have had a really good response to COVID-19 because of acting quickly and the way that they mobilized everything within their country to keep the spread from getting too much out of control. Maybe it has to do with women having a level of compassion and acting quickly, because I don't know, maybe women think more on a maternal basis as to how it can affect their citizens. I don't know what the reason behind that is, but definitely women have been able to show their level of leadership in some of these countries. There's somebody who's posted a question, and I don't want to necessarily pinpoint on certain leaders, but the person's question is saying, how can we fix Africa if leaders like leaders of the Congo destroy the country to get minerals for other countries in Europe and North America? How can we fix Africa if some of the leaders are destroying their own countries?
Well, that's what I was saying earlier, that this opportunity should not be missed, where now we start to open our markets to each other in Africa. If these minerals were open to each other's markets, they would not, and if they were not monopolized by somebody from outside, these kinds of issues would not have arisen. One. Second thing is also remember the African states as they are with their boundaries never respected the community setups when they were drawing these boundaries. So therefore, the one country cannot sit on its own interest alone and not have an interest in the states of another state. That cannot happen. This is Africa. So we are all integrated unless we, as a leadership level and also as regional and continental bodies, rise above these things and start to realize that our collective potential and our collective interest is actually one and the same, and that we can all move in one direction, then all these little squabbles here and there are going to continue to happen. These are the diversions that we have been allowed and being pushed to get into without actually looking at our collective interest. There is no one country in Africa that can give you a list of 10 national interests that are different from any other country on the continent. It's impossible.
Okay.
And
The person who asked the question, I was trying not to mention specific leaders' names, but that person has posted their question in here again. So the person is on YouTube. EJS is the person who's watching this live stream. And the question, reading it word for word, so I can let the person know I did read the question, says, how can you fix Africa if people like Paul Kagame destroy countries like Congo to get minerals for the US and Britain and Israel? That was that person's specific question that they asked. And then we have someone named Lion Nakfa on Facebook who's saying, thank you, Girmay, for bringing the Eritrean success story to the front. Well done. True Eritreans are really proud of you. And then another person who says, love to hear the legend, Mr. Girmay Haile. Thank you so much. Yes, you have so much knowledge and you bring an insight that a lot of people don't think about. I have friends who are in Canada and the US who don't really hear much about Eritrea. And so some of them were really excited to hear that you were going to come on this live stream to talk about the successes in that country. I did have people who would continue to say that it is a one-party militarized state. Those were the exact words that people used when describing it and saying that they don't trust information that's coming from Eritrea. So how can a person who feels that way be convinced that the success that's being reported from Eritrea is actually the truth? Because that particular person doesn't believe it's true and believes that it's that there's information that's being kept from the public.
Well, if the question is specifically directed at Eritrea, the answer is very simple. If you are an Eritrean and you are engaged in your national affair, you will know whether it's true or not. So that is a very simple one. But for those who see Eritrea from the outside and probably are subjected to the unfortunate mainstream media demonization of the country, now is the time to start to understand why this country has been targeted like this up to this point. This is a country that had refused any kind of assistance from anybody, that does not want any donation, wants to do its own job itself, no corruption, and wants to be able to stand up on its own feet using its both human and natural resources. That is the commitment, that is the style, it's a self-reliance approach to national development. Is it dictatorial? Is it any of those other things? Well, I mean, this is a young nation. And if every single country in Africa looked back at their own history, when they were 10 years, 20 years, 30 years old, and remember what they went through, maybe this country has done probably better. And in the future also, nothing is going to prevent this country from also evolving. But the trust and the belief, the political line that we see there is Eritreans are united. They have a common purpose. They have a common commitment to their countries, and they will make Eritrea better in every sense that it will take in going forward. So I personally have no doubt that this progress of the country is going to continue as it is, because It is a country that has paid a lot of sacrifices. No other African country on this continent paid as much sacrifice as Eritrea to get its independence. It has been the key victim of the Cold War. It had been the key victim of maneuvering and all kinds of ill-fated desires of the previous Ethiopian government. And it was only when Prime Minister Abiy came that he realized that actually Eritrea was being sanctioned wrongly and that Ethiopia had a case to apologize and to therefore restore the dignity of this country. Once your dignity is restored, once your economy has stabilized, once peace comes and you are working towards progress, all these other issues that seem to be luxury at this point in time will come. I mean, it has to be a natural growth. Eritreans do not accept domination by anybody to tell them, you have to democratize, you have to do this, you have to. They don't like that because they paid a lot of price to get their independence. So I think this is how I can explain for now.
Okay. So, I mean, I may have some viewers here who don't know the history of Eritrea, because you mentioned that Eritrea was a key victim in the Cold War. How did that happen for those who don't know?
Yeah. Well, when Africa was partitioned, Eritrea was taken by Italy. And before Italy came to Eritrea, for 300 years, there was the Ottoman Turks that ruled for most part of Eritrea, and also the Egyptian also that ventured down the Nile to the sea. And so therefore, this was what we call the Kingdom of the Sea, that is located right on the Red Sea, on the southern tip of the Red Sea, and is exposed to all kinds of external threats. And so therefore, this was the history of the country. So when the Italians occupied it and colonized it, and at the end of Second World War, Italy was part of the losing party, then there was a decision that needed to be made on how to dispose the Italian colonial territories. This was Libya, Eritrea, and southern Somalia, the Mogadishu area. So when they sat to discuss about this at the United Nations, they didn't have much of a problem to dispose Libya because at that time nobody really thought Libya had all that oil and everything. They looked at it as this dry desert, so they just said, okay, it can be independent. And Somalia, they said they can unite the British Somaliland, the French Somaliland, and the Italian Somaliland, and since they speak one language, they have one religion and everything. And again, another dry place that nobody thought was quite strategic at the time can take its independence. But Eritrea became a hotly contested piece of territory. The British wanted to partition Eritrea into two, to give the western, very fertile part of Eritrea to the Sudan, which they were controlling, and the eastern part, which is the coastal line, to the emperor of Ethiopia, who was an ally of the Allied forces at the time. So therefore, he needed, he has been asking for access to the sea. So therefore, that's what they proposed. But a United Nations Commission went to Eritrea, did a referendum. Over 76% of Eritreans said, we don't want to be partitioned. We don't want to be given to anybody. We want independence. And that was brought back to the United Nations. And at the United Nations, then the United States Secretary of State at the time, or was he representative to the UN, Dulles, Foster Dulles, said, in view of justice, Eritreans should be independent. They should get what they want. But because of our interest, our regional geopolitical interest, and the need for America to control this, we should federate Eritrea with Ethiopia. So a federation under the crown of the emperor was decided, and Eritrea was given into that federation by force. So Eritreans did not want that. But at that time, it was the first African country actually to be in the decolonization process, except it didn't get its full independence. So Ghana became the first country to be independent. So this was in the 1950s, early 1950s. So for 10 years, the federation stood, but with a lot of abuse and a lot of fight. And eventually, Eritreans took up arms to fight for their independence in 1961. And in 1962, in 1962, just before the African Union or the OAU was established in 1963, then they decided to include an article in the charter of the OAU, which said that as we sign the charter today, we also recognize each other's borders as it is today. So the emperor made sure that Eritrea was forcefully annexed into Ethiopia as a province in 1962. And by the time 1963 the OAU was established, Eritrea was already seen as part of Ethiopia. But the liberation movement continued until 1991. It was a heavy, heavy one. And in 1991, it got its liberation. And in 1993, it got its political independence. A UN-sponsored referendum was carried out to determine its political independence. So this is it.
Well, it's quite a history. I know there's so much more that could be said about, what happened with Eritrea throughout history. But right now, I believe that even with people feeling that because it is a one-party state, there's a lot of people who still feel that they can't trust what's being said. There's people who do feel it should be a democracy. I mean, everybody has their different views on this topic, and we could go on and on and on about this. But I strongly believe that there are definitely lessons to be learned from some of the things we've said. Reacting quickly, mobilizing quickly, doing the things that needed to be done to make sure that the virus didn't spread. Those are some of the things that Ghana was doing as well. Ghana was quick to do quarantine of people when they were arriving on flights and mandatory testing of those people who arrived and doing their best. But Ghana has really had a huge growth in case count in the country. But I think that, we're here talking about Eritrea today. So I think Eritrea has done a phenomenal job, and people can learn from it. Other countries can learn from Eritrea's done, from what Senegal's done, from what so many different African countries have been doing, but is not getting enough press. Closing out, I want you to say why you think that the world is not looking to Africa to learn lessons on how to handle COVID-19.
Well, it's interesting you used that as a closing question. There was an article written by Afua for The Guardian. I mean, since she's a columnist of The Guardian, I guess she will have to sing the song, but that's fine. But with all due respect to her, I think it's the domino effect of the way Africa has been handled up to this point by the big powers to be, and so therefore, it is not in any way surprising that they are not learning from Africa, and it's not in any way surprising that they're not even highlighting what is going on in Africa. Mm-hmm. My intellectual, personal, and Pan-African approach to these things is forget what they think about Africa. Let's talk ourselves about our own Africa. Let's create the image and the belief and the standard on our continent that we want that works for us. As far as we're concerned, that article was just a rehash of why and what, but necessarily not exactly who we are or not exactly what our destiny should be. And I think those kinds of discussions probably do not give us any value, because I don't think we have spoken enough amongst ourselves, about ourselves, and for ourselves. And I think we should go in that direction. But just before I close, though, I see one or two comments on this old argument about colonization by Ethiopia or Eritrea and all those things. It doesn't matter what you call it, colonization, occupation, annexation. It's just a situation in which Eritrea had found itself by force and voted in a political referendum to conclude its right to self-determination. Eritrea was never separated from Ethiopia. I know Some people say that it is not a case of separation. This is a case of decolonization, the whole process of the right to self-determination. It came to its end at that point. Thank you.
Thank you so much for spending the last hour with me. I know the beginning was a little bit of a tough start with the audio, giving that feedback. It's always a pleasure talking to you. It's always a pleasure hearing what you have to say, because you have so much knowledge. You're such a brilliant person. When I first met you, I always knew that you were always somebody I enjoyed talking to and getting information about and learning from when it comes to Africa. We haven't talked in a long time, so we need to talk again soon. You know, after this, I realized, you know what, I need a little bit more of Sir Haile in my life conversations.
Thank you, Thank you very much.
Thank you, thank you. And for everyone who tuned in today, I really appreciate you tuning in and hanging in there in the first few minutes when we had some technical issues here on the stream. Stay tuned. I'm going to be doing more live videos with other people talking about things happening in Ghana, in Africa, and other places of the world. And if you have any ideas or any questions, feel free to send them to me in my inbox, and I'll do my best to answer. If you want to reach out to Haile, same thing. You could find him, I'm sure, through social media as well, on Twitter and on Facebook, to share your ideas as well. So let me just read these last couple of comments. Somebody said, may you, Ivy prosper. May you, Ivy prosper. Can your platform spread good progress of African countries, not only with this pandemic, but in all areas? King Jacob says, if African follows self-reliance policy as countries and as a continent like Eritrea, what kind of change can we see in the next 5 to 10 years?
Big change.
Self-reliance is definitely the way forward. Thank you so much, everyone. Thank you, Haile, again. And this is going to be the end of our live stream. We'll see you again next time. Thank you.
Thank you.